Hi, Dr. Jesse Scholes here to talk to you about headaches. Headaches are something that a lot of us get, and many times you can get headaches that can be from just tight muscles around the neck, the face, or the head. Now, what I'm going to be doing is showing you a couple key muscles around the neck area that you can release that many times can aggravate a headache or be causing a headache directly. Now, the first muscle, if I turn my head to the side, you can see this muscle right here that kind of pops out. It's called the sternocleidomastoid muscle. Now, in order to release this muscle, what you can do is you can do what I call the upside down handshake. So for the upside down handshake, you take your hand and you put it on your neck with your thumb just in front of that muscle here. And then what you're going to do is you're going to kind of grab your neck with your hand like this to kind of pinch it and hold it in place. And as you pinch and hold that in place, you turn your head to the side. And as you do that, you should feel all this tension developing right where your thumb and your hand is grabbing onto the side of your neck. Sometimes this muscle will kind of pop underneath your thumb if you don't have a good enough grip. But if you just hold on firmly enough and turn your head away as far as you comfortably can, hold for 2 to 3 seconds, turn back to the center, re-grab, turn away, hold for a few seconds, and you repeat that on both sides about 10 times. If this muscle's causing any sort of neck strain or headaches, you'll feel some relief. Now, this next one's a little bit more complicated, but not a lot more. The scalenes are muscles that run vertically on the side of your neck, right about here. And if you hold onto your neck with your fingertips, where you just kind of gently push in, you'll be able to feel these deep, vertically running bands. And those muscles are the scalenes. Now, there are some nerves and blood vessels that run through that area. So if you're pressing on that area and you're getting dizzy, lightheaded, like a zappy nerve pain, anything like that, you're on a nerve. So try to find those more prominent, tight muscles. And what you're going to do is you're going to reach with your opposite hand and find one of the, we'll say the lower half portion of one of those muscles. You're going to bend your head towards that side. You're going to press directly in towards the center of your neck with your fingertips. And while you're maintaining that pressure, kind of glide your fingertips down like you're trying to stretch the muscle. And then what you're going to do is you're going to tilt your head away. And as you do that, you should feel a very direct stretch onto those muscles there. Again, you bend your head towards the side to relax the muscles. You put some pressure directly in, and then hold a little bit of pressure down, and hold that pressure as you tilt your head away. And after you do about 5 of those to the band of muscles in the front, then you're going to move back about 1 inch, find the middle band, and the same thing. Tilt to the side, put pressure directly in towards the center, then down, to tack that muscle down as you stretch your head away. And again, we're going to do about 5 of those. And then after you do 5 of those, if it's tight, you're going to go to the back band. Again, this will be the last or third band that's a little bit behind by about 1 inch, the last one that you just found. And do the same thing. Bend your head to the side, push in, hold some pressure down to stretch it, and tilt your head away. And of course, you would try to do this on both sides. Usually both muscles are tight. Now, there are some muscles in the back part of your neck that can cause problems too. Now, the easiest one is the upper trapezius, or this muscle that you can see kind of right here on your upper shoulder. Now, if there's a trigger point there, stretching it will be effective, but not very effective. So if there's a trigger point there, what I would recommend is either using your hand or some sort of trigger point release stick to find the tender spot, which tends to be right dead center in the middle of it. And all you're going to have to do is push down into it with your opposite hand and hold pressure for about 30 seconds. After 30 seconds is over, then you can actually stretch it. And if you don't have any neck joint issues or any other significant issues with your neck, you can pretty much go into this stretch with full motion without any worry. But if you do have some issues with your neck, I would say exercise caution with this, because you don't want to put too much pressure on a disc or on a joint in your neck. But what you're going to do to stretch this side, to stretch my right side, I'm going to bring my chin down. I'm going to keep my chin down as I tilt my head away or to the left. And then I'm going to turn my face or spin my head a little to the right. Now in this position, I don't personally feel much of a stretch with my chin down, my head tilted to the left, and my head spun or rotated to the right. But if I put my hand on the top of my head and let the weight of my arm gently hang on my head and pull my right shoulder down, now I feel a very direct stretch. And not only will this loosen up that upper trapezius muscle, but it will open up the joints in the back of your neck too. After you hold this for about 30 seconds, I would repeat it on the other side. And just because a lot of people get confused about this stretch with which way to move their head during the stretch, I'm going to show you how to do it on the other side as well. So for my left side, after you do the 30-second trigger point release, assuming you find a tender spot, bring your chin down, keep it down, tilt your head to the right, spin or turn your face to the left, right hand on the top of your head to let the weight of your arm gently hang on your neck, and then pull your left shoulder down. And again, we'll hold this for about 30 seconds. Now this position and stretch is almost the exact same one for the levator scapula muscle, which is a muscle that we'll be doing next. The levator scapula is a much smaller muscle, runs from the inner upper corner of the shoulder blade to a couple of the joints in the middle part of the neck. And what I would recommend is you get a lacrosse ball or a baseball. You can put that in a sock, a long tube sock, and what you can do is throw it over your shoulder, and then you can lean against a wall, find the tender spot in kind of this area somewhere here, assuming there is one, and just hold pressure on it for 30 seconds. Make sure to keep the arm relaxed, that the ball's on that side. And again, after you do that, assuming there is a trigger point there, then you would do a stretch for it. And the stretch is going to look so similar to what we just did. If I'm stretching my left side, your head's going to be down. Your head's going to, again, be tilted to the right. But instead of turning our face up or to the left, now what we're going to do is turn our head down to look almost at the right armpit. I'm going to put my right hand on the top of my head, gently let the weight of my arm hang on my head as I pull my left shoulder down. And now I feel a much more defined stretch in this little band called the levator scapula muscle. And after I hold for about 30 seconds there, I will then repeat on the other side. So again, ball in a tube sock works really well. If you can reach back there, you don't even need the tube sock. You can just put a ball on your shoulder and roll on the wall to find the best tender spot. Then after 30 seconds of pressure there, chin down, tilt your head to the left as you're keeping your chin down, and look down towards your left armpit. Let the weight of your left arm hang on your head, pull down the right shoulder, and again, you should feel that very well-defined stretch. Now, if you still have a headache, there's a group of muscles called the pterygoids that I'm going to make a video about. And I'm also going to make another video about doing a face and head massage, which can be very helpful for people that actually have connective tissue tension through the muscles of their face and head, which sounds a little weird, but if you're a person that tends to kind of frown a lot, those muscles for frowning can actually compress things around the head and tie into the back of the base of the skull, which a lot of headaches are generated from. But I hope this video is helpful for you. I would recommend that before you do this, you consult with your physician, your physical therapist, chiropractor, someone in the medical field to make sure that these are the right things for you to do. But I hope this helped. Thank you for watching.